This is an interview with Dr. Jazmine Oliver for the Youngstown Historical Center of Industry and Labor Oral History Project titled Women at Work. The interview is being conducted at the Steel Museum on April 13th, 2023, and my name is Susan Lowry. Hi, how are you?
I'm great. How are you today?
Doing good. How are you? Oh,
good.
Yeah, great. Okay, so I'm going to have a couple of introduction questions for you. First, where did you and your family grow up? Or where did you guys live?
So I grew up on the south side of Youngstown.
Oh, okay.
Mainly on Ferndale Avenue, which is the upper part of the south side near Midlothian.
Oh, okay.
And then I think maybe junior high, we moved into Mill Creek Park area. And that's where we were until I left to go to college. Okay.
And what did your parents do for a living?
So my mom was a revenue agent and retired from the Internal Revenue Service.
Oh, okay.
And my dad was a certified public accountant. So they're both in the tax industry.
Ah, okay. And where did you go to high school?
I went to Cheney High School.
Cheney, okay. And can I ask what year you graduated from?
2000.
2000. When you were going to high school, did you have a job?
I did. I had several.
Did you? Can you talk about those?
Of course. So my first job was at Handel's Ice Cream.
Yes.
On the south side, scooping ice cream and
nice.
Making minimum wage and tips, but it was a lot of fun.
Yeah.
And then I got a job at Boston Market in Boardman.
Oh, yeah.
So I worked there during high school. And then one other job that I had was actually as a bank teller right before, I think my senior year, before I went to college.
Oh, okay.
I was a bank teller at National City, which I think is now PNC. I think.
Oh, okay.
I can't remember what it has,
Yeah.
who has bought it at this point, but that's where I worked. Those are my 3 jobs during high school.
Okay. Now, after you graduated, did you go, you know what, I think I already answered that. You did go straight to college
Yes.
then. Where did you go?
I went to Duke University in North Carolina.
What made you decide out down there?
So actually, when I was a student at Cheney, I spent a lot of time in the library and connected with the librarian, Mrs. Ross, there. And when it was time for me to go to college, I sort of discussed with her my choices as far as where I wanted to apply. And there was actually a student from Cheney who had went to Duke University some years prior, and she encouraged me to think about it and look at it as an option.
Yeah.
And then I believe maybe my junior year, my parents took me down to visit the campus, and I just fell in love with it. And so I applied there along with several other schools during my senior year. And when I was accepted, like you couldn't tell me that there were any other options.
Understood. And are you married?
I am.
Yeah.
I got married in September of 2019.
2019. Oh, okay. Very good. And how many children do you have?
I have 3 children.
How old are they?
So my daughter is 14.
Okay.
My son is 2, and my youngest daughter is 3 months.
Oh my goodness. Woo. So you went to Duke University. Did you know at the time when you went to Duke what you wanted to do?
I did.
And what was that?
Be a physician. That was my ultimate goal, was to go to medical school after undergraduate.
Okay. And how old were you? What led to that desire, that passion?
So it goes back to prior, in high school. So my dad was a big history buff, and he would watch the History Channel, and he would read biographies, and he gave me Ben Carson's biography, Gifted Hands.
Okay.
And said, Jazz, you should read this. And so I did, and it's probably one of the only books that I read that he encouraged me to read. And I just really connected with the book and his experience. And he talked a lot about his experience, not only growing up, but also going to school, getting into medical school, his training in neurosurgery, and that just really inspired me to want to become a physician of some type.
Yeah, that is awesome.
So from that point on, that was what I felt destined to do.
Okay. So then when you went to Duke University, your focus was on the medical field to be a physician. How many years were you there at Duke?
4.
4, and you graduated 2004?
Correct.
Okay. After that, where did you go?
So after that, I spent 2 years at Southern Illinois at Carbondale.
Okay.
I did a post-baccalaureate program that helped me to strengthen my application for medical school.
Oh, okay.
And helped me to study for the exam for medical school. It's called the MCAT. Everyone who goes to medical school has to take it.
Okay.
And so I did that. I did well on the test, and then during my second year at Southern Illinois, I applied to medical school and interviewed, traveled around to different medical schools interviewing, and then I ultimately chose to go to medical school at Cleveland Clinic Lerner College of Medicine, which is a medical school, was a new medical school at the time, at Cleveland Clinic.
Oh, okay. So you there on the main campus?
Yes.
Oh, I see. And then is that was like a type of internship then?
No, so this is medical school. So after,
Actual medical school.
Right. So after undergrad, there's 4. Most medical schools are 4 years. Cleveland Clinic and a few others are 5 years because there's an additional research year requirement.
Oh.
And so I chose to go there. And what medical school is like, at most places, the first 2 years is really heavy in the classroom, learning what you need to know to be a physician. And then the second 2 years are what we call your clinical years, where you are doing different rotations throughout the hospital to get clinical experience and to help you decide what specialty you would like to choose to focus on.
I see. Okay. And what did you decide to focus on?
Internal medicine.
Internal medicine.
Yes.
Okay. Does that mean you're also a surgeon as well?
No.
No.
So, the internal medicine training is focused on the care of the adult patient with acute medical needs, meaning anything that's internal to the body. So usually neck down, although at some places internal medicine physicians will take care of brain issues like mini strokes or strokes.
I see.
So if you come to the hospital and you have pneumonia, or you've had a heart attack, or you have a GI bug and you need to stay in the hospital, 9 times out of 10 you are going to be being cared for by an internal medicine physician.
Okay.
Now, if you come to the hospital and you broke your leg, you don't want an internal medicine physician. You want an orthopedic surgeon, right?
Got it.
So I chose to do internal medicine.
All right. And during this time of your training and schooling, did you ever find that there was any type of favoritism or, say, biases, discrimination? Did you feel that either as a woman or even as an African American?
So,
and if so, can you give an experience? Share one.
For sure. So, oftentimes, and this still happens to me when I go out, I wear my white coat all the time when I'm seeing patients, and I'll go into a room with a patient to introduce myself, and let's say they're on the phone. Well, they'd be like, "Oh, I gotta go. The nurse just came in," or I've had people ask me, "Am I there to get their tray? Their dinner tray or what have you."
Interesting.
So at first, I thought internally it's because of my race. But, as I mentioned earlier, talking with others who are unlike me about their experiences, I realized that a lot of women in general, regardless of race, if they're a physician and they go in the room, they are assumed to be the nurse until proven otherwise.
Yeah.
And it had nothing to do, at least with race, and with that instance, it was more a gender issue. Yeah.
And so would you say that it was nothing about them being insensitive per se, just maybe being more ignorant of those type of
Yeah, they
just
biased,
didn't know.
You know,
Yeah.
you're a woman, you're not a doctor.
Yeah.
And that's the bias that they have.
Yeah. Now, at first, did that hurt? Did that make you feel angry, or is it?
At first, both.
Yeah.
And then I realized that, unfortunately, it comes with the job, and I got used to it. And then sometimes I would have patients say, when I say, "Oh no, I'm Dr. Oliver," they would say, "Oh, I'm so sorry. You know, I didn't mean to assume," or "Please forgive me." You know, that kind of thing.
Well, how about with like any type of coworkers or either above you, equal to you, or above you? Was there any other kind of discriminations there?
Not that I felt. I think I was very fortunate in that I didn't experience it at the places that I trained. I do have friends who are Black women who train in other environments where they did feel like they were treated differently.
Interesting. I see. And then, where I forgot to ask you this. I'm so sorry. Where did you have your fellowships and
my residency?
Yeah, your residency.
So my residency in internal medicine I did at Beth Israel Deaconess in Boston, Massachusetts.
Okay.
So I was in Boston for 5 years.
What led you to Boston?
So when you apply for a residency program, for your residency, you sort of think about what are some of the best programs, where do I want to be physically, and what do I want to do after that, and where are the hospitals that are going to get me to the point where I would like to be career-wise 5 or 10 years down the road. Okay. And so Boston has some of the best programs. Regardless of what residency you go to, they have some of the best hospitals in the country. Cleveland Clinic is really good. So I sort of I applied back to Duke. I think I applied maybe to 15 or 20 internal medicine residency programs. And you kind of have to do that. You go through what's called a match process. I'm not sure if you've heard of it.
No.
So you apply to all of these places where you're interested potentially in their program. And then you may or may not get selected to come there for an interview. Okay. So I think I applied to maybe, like I said, 15 or 20 places. I went on 12 interviews, so I had to travel to all these places. I applied in Chicago, Boston, North Carolina, Tennessee, Illinois. Wow. I stayed sort of in the Midwest, Northeast region. I didn't go west or south too much. Yeah. No further south than North Carolina, no further west than Illinois. Gotcha. And then after you've applied to all of those places, you create what's called a rank list. Okay. And you rank those places from 1 to 12 because, I went to 12 places. If there was a place that I really hated when I interviewed, I wouldn't rank it. I would just rank 11 places. And number 1 obviously is the place you fell in love with, you really want to be, and then you go down from there. I see. And then they do the same with you. They rank you amongst other people that they have interviewed, and so you have to match up within a certain range, let's say. So if they have 60 spots and they ranked you 25 and you rank them 1, you'll match up and you'll get to go to your first choice. Well, if you rank them number 1 but they ranked you number 100 out of 60, then you have to hope that 40 other people say, I don't want to go here, or rank somewhere else higher to bump you up. Does that make sense? Yes, it does. There's a complicated algorithm because there's thousands of people applying, right? Oh my goodness. But then you have something called match day, where you go and you get an envelope and you open it up and you find out where you matched, and that's where you go. So I could have matched at my number 10 place, and I would have had to go there for residency training. Yeah. Thankfully, I matched at my number 2. Okay, good. I was really happy. That's fantastic.
Well, you know what? During your residency, you're a resident.
Yes.
And you know what? I hear this word tossed around all the time, but honestly, I don't know what exactly that means. Right. Can you explain it?
Yes, it means you live in the hospital.
No. Well, you know what? That is going to be one of my questions. Is about your shift.
Yeah, so it means.
So talk about that.
Of course. So when you're a resident, you spend a lot of hours in the hospital. It used to be unrestricted, meaning you could literally live in the hospital and not go home at times,
Wow.
especially depending on your specialty. Then they got very restrictive with the hours because there was patient harm being done by residents
Wow.
doing things to patients because they were exhausted, residents getting burnt out, an increase in the number of suicides among residents, and all kind of things that have occurred in the past that led the accrediting bodies to say we have to do something about this. So they restricted the hours to 80 hours a week.
I see.
As you know, most full-time jobs are 40 hours a week. So
Yeah.
that's still double
Wow.
the normal.
Why do they do that?
expectation.
I mean,
Because you have to have intense experience in a lot of different domains within your specialty to be competent. You really do. You don't want a physician who does not have experience, right?
Right.
This is your life.
Right.
Imagine, surgeons, right? You don't want someone who's inexperienced. And
I
when you're
see.
done with residency, you are deemed capable to practice independently, meaning
I
you don't
see.
have anyone overseeing you anymore. When you're a resident, you have what's called a supervising or an attending physician, which is what I am now. That's what you are when you finish residency.
Yeah.
You're done with the training aspect of things.
Okay.
And then you then have residents under you who you train to do the same thing.
yeah.
And so you want someone who is experienced and who's, done many hip repairs, let's say, right? You don't
Yeah.
want someone who has done 5 or 10, right? Exactly.
Okay.
So you have to put in the time.
Yeah.
And if let's say it was a 40-hour work hour restriction, instead of an internal medicine residency being 3 years, it probably would be 6. It would be double, right? Because you need that time to get the experience.
I see.
Same thing for surgeons. Most surgery residencies are 5 to 8 years, and so it will be double that.
Okay.
So you would be near most people's retirement age by the time you get done with residency if your hours were severely limited.
Okay. How many hours do you usually get about now?
So now I can do an 8 to 10 hour day.
Okay.
And that's okay. 12
Okay.
hours is a long day for me, and it's rare, thankfully. But I did put my time in. When I was a resident, we had the longest shift that we were allowed to do was 28 hours.
Wow.
It would go to 30 sometimes. They called it a 24 plus 4, meaning I would go into the hospital at 8 in the morning. That's when I would need to be there, and I wouldn't leave until noon at the earliest the next day.
Wow. That's crazy.
Yeah.
And you have 3 children, 2 just pretty much babies still. So those times that you were pregnant, though, did they accommodate you being pregnant? Did you feel any discrimination being pregnant?
Was there an accommodation? No. Did I feel discriminated against? No.
Okay,
I would
good.
say that, so when I had my daughter, I was actually in medical school when I had her. And so medical school is a little bit more flexible.
Okay.
In that you have a little bit more elective time that you could switch your schedule around and
I see.
make it a little bit lighter. But I still had to extend my medical school 1 year so
I
that
see.
I could get done what I needed to get done to graduate.
Right.
And then, but I will say in internal medicine, I would say a more family friendly specialty. A surgical specialty would be much more difficult. Not that it's impossible, because
Yeah.
women do have families who are surgeons, but it is difficult.
I see.
I
Okay.
remember when I was doing my surgery rotation as a student, and I was paired with a colorectal surgeon who was a female, and I had to work with her every day for 5 weeks.
Okay.
And she had a son, but she said, I told my husband, now she's much older than me, and so you can imagine, one, there's not that many female surgeons, and 2, when she trained many years ago, there were even fewer. And so the environment was not supportive of that, right? Because it's looked at as if when a female is out to have a child, that their colleagues are left behind to carry the weight.
Yeah.
And so she told her husband, if I have this child, you got to raise him.
Wow.
You got to stay home and take care of him. And he did. He became essentially a stay-at-home dad.
Yeah.
And it worked, you know, for them, thankfully.
How's it working for you?
That was the sacrifice that she had to make.
Yeah. How's that working for you and your husband right now?
It's great. You know, we have a lot of family support. I will say when I was in medical school and in residency, I was a single mom.
Okay.
And so my mom actually moved to Boston with me to help me with my daughter. I was very, very blessed to have that.
Yeah.
Because otherwise I wouldn't have been able to do it.
Yeah.
I mean, I would have figured it out, you know,
Yeah.
but it would have been much more difficult. So I'm really thankful that she was there.
I'm thankful for you. Oh my gosh, that's awesome. Because that's one of the topics too, is, you know, that whole double shift, second shift mentality for women. Now, you know, back in the 50s, it was the woman stays home, they do this, they do that, all housework, motherhood. And then the father, what does he do? A lot of times it seems during this day and age that, the husband, he picks up some of that slack. And so you're saying, though, that your husband does do that with you.
For sure. So he's home with the kids now, you know.
Yeah,
so he can be
fantastic.
Here. And he's great. You know, I still want to be a good wife and mother. And so even when I work and I drive to Cleveland, I come home and I cook dinner, you know, and help get the kids ready for bed and, you know, that kind of thing. And so it's exhausting, but, you know, it's worth it, and we make it work. And we have help. We have my mother-in-law. She's wonderful. She helps us as much as we need her to with the kids. My mom helps as much as we need her as well. So that's part of the reason that I moved back. I originally was living in Cleveland when I moved back from Boston. Yeah. And I moved down here. All my family is here. Yeah. And so it just makes sense that, and you really do need that sense of community and support when you have little ones. Yeah.
Past or presently, how would you rate the overall atmosphere for women in the workforce?
On a scale of, say rate?
Yeah, like, I mean, it's based on what you know of personally.
Yeah, I will say I believe that is much better than it was. Especially, at least in what I do, there are a lot of discussions around gender equity when it comes to pay, let's say. For female physicians. Now, we still don't make what men make, but it's better than it was. Okay. But still not on par. And the transparency around that is not the best, but institutions are now bringing on equity advisors or so to look at salaries and make sure that things are more equitable and based on, you know, experience and accomplishments and that sort of thing rather than gender. Good. And same thing with senior leadership roles. In the past, you would not see a lot of women physicians in leadership positions in medicine. I can say that, Cleveland Clinic is a wonderful institution in general, but we do have a lot of women of different ethnic backgrounds in leadership positions, as high as presidents of some of our regional hospitals. And so I am excited and encouraged by that. And because I still feel that I'm, you know, young in my career, maybe more mid-level-ish I'm getting to. And so the opportunities to move forward, I feel, are more apparent than they may have been in the past.
I see. Yeah. I'm also interested in what is what a typical day. You go into the office, you do your rounds, you communicate. What would not be a typical day?
A not typical day is, an unstable patient, let's say.
Yeah.
So a lot of times, at least in what I do, there is sort of a, I guess for lack of better words, process that patients go through from when they initially come to the hospital, the team figuring out what's going on. So a diagnostic part of their stay, a treatment part of their stay, and then getting to the point where you've done all you need to do in the hospital and they're safe for discharge home. Whether or not the treatment may not be done, they still may need a lot when they leave the hospital. But there's a path that everyone takes.
Yeah.
And then you have patients who come to the hospital and get worse. Or they, take a turn for the worse, or there's a change in their vital signs, or, God forbid, there's a code blue.
Yeah.
And that for sure throws your day off.
I see.
It only takes, out of a list of the number of patients I see in a day can vary from 10 to 12 to 20.
Okay.
On average.
Okay.
And so you only need one sick patient to throw your whole day off, because you have a system, right, of coming in, reviewing all the data that it's come in since you left the hospital the day before, going and seeing all your patients, communicating with your nurses, writing your notes, getting patients discharged, admitting new patients, and wrapping up your day. So in the midst of, and I do teaching as well, because I do teach our residents.
Oh,
and so
okay.
In the middle of that, one sick patient throws off that whole algorithm, because you have to stop what you're doing, obviously, to focus on that acute need.
Yeah,
and so
I see.
That's an atypical day.
Yeah.
A day you hope not to have, but it happens.
Yeah.
It does happen.
How often does that happen for you during a week?
Less than once a week.
Less than once a week.
Thankfully.
Okay.
Yeah.
All right, that's good. How do you overcome that challenge personally?
Oh, you deal with it. I think it comes with the territory. You get used to it once you've been through residency. There's not much you haven't seen or done. You always see new things and new challenges, but there's not much that you feel unfit to handle. Yeah. And there's always help, right?
Yeah.
So I'm on the regular floors in the hospital. We can always escalate the care to the ICU if needed. And so it's really a collaborative team environment.
Okay. You were talking about the opportunities moving forward, or maybe even a higher ranking kind of job maybe. Do you see yourself moving forward?
Yeah, I already have a couple of roles. So when I was in Boston, I had the opportunity to be what's called a chief resident, meaning after you finish residency, a chief residency is someone who has been chosen to help be advocates for residents, help with administrative tasks for the residency program, teaching residents, and that's a full year. And so I did that for a year, and that gave me a lot of experience of understanding what makes a residency program run and keep it successful. Yeah. And so when I moved back to Cleveland, I knew that I wanted to get into stay in medical education.
Oh, okay.
So there are a lot of things that physicians do that's not just seeing patients, and medical education is one of those things. You typically will think of, research or maybe teaching. Medical education is big. Running a department, being a department chair or something like that. And so my passion after doing a year of that was to stay in medical education and to teach residents and medical students. Yeah. And so now I have a role in our residency program, teaching residents to train them to do what I do if that's their interest when they get out of residency. And then I also have a role in the medical school where I work to recruit diverse students to our school to make sure that we are an inclusive and diverse school.
Very good. How's your relationship with your coworkers, both men and women? Pretty good?
It's great.
Oh, that's good.
It's great. Definitely.
Obviously, though, I mean, there's always like one or two people. When you do come in contact with somebody that you are struggling with, how do you overcome that? Like, well, I think in your case, you can't move to another department, but do you lay it low? Do you communicate with them? Do you communicate with your supervisors to work with them?
Yeah.
What do you guys do in a situation like that, or you yourself?
Most of the issues that come up between colleagues is not like a disagreement about medical care or anything like that. It's usually just like a professionalism issue. And so, you know, we do have means for reporting that, like mistreatment. We do have mediation that can happen if it got to that level, if it was that serious between two physicians. Thankfully, the environment is much more collegial, and if there are people who, especially in my specialty, I think internal medicine is a very friendly specialty, and so if there's someone who may feel in a derogatory way towards me, I don't know it. You know, I think either they know to keep it to themselves because of the environment that has been created, the culture there. I like to think that I get along with most folks, and you know, the people that I have had run-ins with, you remember that it sits with you, you know, doesn't feel well. And thankfully it wasn't a colleague who I had to continue to work with on daily. It was actually with a nurse when I first got there. And I disagreed with what needed to be done, and she was like, well, I've been here 20 years and this is how we do things, and she was wrong. You know, at the end of the day, she was wrong with how she does things. So, of course, yes, I felt validated because I knew I was correct, but at the same time, it shouldn't have been that, you know, so.
I see. So one of my questions that I also like to ask is twofold. One, what do you like the most about your job? And then after that, what do you like the least about your job?
So what I like the most is definitely patient care and teaching residents. That's what keeps me going. And even when I went back to work after having been off for 12 weeks for maternity leave, it felt good being back. And so that was validating for me to know that, like, I must be doing what I'm supposed to be doing because I enjoyed the work and being back in that environment. What I like the least probably is just sort of, I mean, in any field there's going to be like bureaucracy issues, and when it comes to senior leadership and dealing with personalities. And so that is what I like the least, because there's so much work that can be done and needs to be done that it should really just be a collaborative effort so that we can get the work done for the betterment of the program, the hospital, the patients. So that's what I like the least about it. There's not much of that, but there's always some, right? There's always some.
And then let's see here. What are your hopes and dreams afterwards, after you retire?
My hopes and dreams are to travel.
I hear that more often than but I love it. Because that would be one of mine too.
I mean, I'd always love to. It's more difficult these days with the young ones. We took my son to, he was, I don't know, maybe 14 or 15 months, and we took him to Hawaii with us. And it was great once we were there, but the plane ride was horrible. And for him.
Yeah.
And I told my husband we're road tripping wherever until they're 5 or 6 years old. We just got to rent a van and get the highway. No more plane rides for us.
Yeah.
For a while.
But yeah, anything else special after retirement? Thoughts or?
I would say, just traveling and enjoying, relaxing.
Hopefully enjoying grandbabies too.
Yeah.
Work in the community. Gotcha.
Yeah.
But hopefully
I do a lot of service related activities, and so having time for that would be great also.
Okay. I want to make sure that I ask this question at the very end, because there might have been something that I didn't ask, maybe because it just didn't go in that direction or something. But anything about your experience as a woman in working in outside the home, is there something you would like to share, or even advice? I even switch that gears over to advice as well if need be. But just something to be able to say to our public audience what you've learned and stuff like that.
Working outside the home and having responsibilities at home is hard.
Yeah.
It sometimes seems as if it never stops. And so advice would be to be sure to carve out a little piece of time for yourself, whatever that is. If it's 5 or 10 minutes a day, if it's 30 minutes a week or an hour a week, where you shut yourself in a closet, or go walk around the mall, or get a massage, or go sit somewhere and reflect and have a glass of wine. Just take that moment for yourself, because it will go a long way towards your own personal wellness, so that you don't feel burnout on both ends.
Yeah. It's interesting that you say that, and I reflect back on what you said about being on maternity leave, but you went back to work and it was rewarding for you, and you felt good, and you knew you were in the right place. So at the same time, even though it's never stops, you don't regret doing what you're doing.
And actually, it felt easier going back to work than being at home with 2 babies.
And you don't feel guilty at all?
I don't. I think in the beginning, when my daughter was young, my oldest daughter, when I was in residency and in medical school, when I was doing I explained the clinical rotations during your 3rd and 4th year of medical school.
Yeah.
I would drop her off at daycare across the street from the Cleveland Clinic when they opened at 6 a.m. and pick her up 5 minutes before they closed at like 7:55 p.m. sometimes.
Wow.
And I felt horrible.
Yeah.
Because I'm like, I'm not spending time with my child. Is she going to know me? Are we going to have that bond? And I felt really terrible about that.
Yeah.
And then the same thing when I was in Boston, working 80 hours a week. And now that she's older, I realized that it didn't affect her at all. Thankfully, she doesn't even remember the daycare stuff except through pictures that I show her. And then the time in Boston, she remembers it as time spent with my mom,
Yeah.
And so that was great for me. She remembered me being there too,
Yeah.
But that's a time when they were able to really connect, and they're still very close, even though we don't live with my mom anymore.
Yeah.
And so now, fast forward, 10 years, I realized that me being away won't affect them. Me being away during the day to work will not affect them in the way that I felt like it would.
Yeah.
And ultimately, it will show them and encourage them to pursue their own dreams and goals from a career perspective.
Yeah. Fantastic. Well, thank you very much. I appreciate you taking the time.
Of course.
Obviously.
I'm glad to be here. Thank you.
All right.